Is he playing well? Or so then I'm going to the lower limb.
Okay.
So and I look
So can
into.
you start just a minute? Hello.
Okay, so then
Start from the beginning.
I will look into his both lower limbs. How are they? Any dysmorphic features? And how is
just a minute. Hello.
hello?
Just a minute. Yeah. Can you start from the beginning?
Okay, I will look into how child is moving at the moment.
Okay. So child is lying in the couch.
Lying on couch, or is he moving?
She is somewhat having pain and she is walking with limping gait.
Okay, which leg?
Yes. So
It's
you.
right leg.
Yes.
Okay. Obviously, I can see there is a obvious swelling on right knee joint.
Okay.
It's swollen, and there's no redness I can see, but I think there might be a swelling and redness.
There is no redness.
Okay, there's only swelling on the right knee joint. So can I examine right hip as well?
Okay. So tell me what you want to examine.
Sorry?
Tell me what you want to examine here.
I want to see that actually I would like to touch both limbs.
Okay.
And then I want to look into is there any pain over the knee joint and as well as the right hip.
Okay. So as you are moving the right knee, there is a pain. Okay. She is not able to move the right knee fully.
Okay, so then I will look into other joints as well of the both lower limbs.
Okay.
Then
So other joint, she is having some difficulty in moving the right ankle also.
okay, so I look into this whether there is any pain in the right ankle as well.
Okay, there is some tenderness in the ankle. Okay.
Okay, so how is his other lower limb, left one?
Left side, she is having movement is full. What do you want to see in left limb particularly? Anything in particular?
Because I want to see that is there any other joint involved in the left lower limb as well.
Okay, there is no swelling in the left lower limb.
So that's mean the left leg is okay and the right problem is having in the right leg.
Okay.
So I think then I will look into are there any worm on both joints, ankle and knee joint as well.
Okay, what do you want to see now?
I want to check that are there any worm on both joints?
No warmth.
Okay, then I will look into the muscle bulk of the leg.
Muscle bulk is equal on both sides, above and below the knee.
Okay, so I will look into then any contusion or any ulcers.
No. Okay, no contusions, no ulcers.
Okay. What else I can see? So are there any? I will check any rashes.
Okay, no rashes.
So, and are there any lumps over the knee joint? I mean, there can
There
be
is
some
swelling in the right knee, but there are no lumps. The whole knee joint is swollen.
Okay. So, can I ask to move limbs? move the
Yeah,
both limbs.
she's not moving the right. There is restriction of movements in the right knee as well as ankle compared to the left knee and left ankle. But she movement is still because of pain. Okay.
Okay. So, what could I say? So, what about his feet? Are they swollen?
No, only ankle is swollen. Feet is fine.
Okay. So there are no redness, no warm. So only pain in the both right knee joint and the right ankle.
Yes.
Other than that, both lower limbs are normal.
Yes.
Okay. Uh, so right hip joint are normal as well.
You want to?
Right hip joint.
Hip joint movement is fine.
Okay. So what about his spine,
Pardon? What about this?
his back, and other upper limbs as well?
Okay. So back is fine. Okay, time over. Okay, 6 minutes over. Okay.
Okay.
Would you like to do anything to complete your examination?
Sorry.
Would you like to do anything to complete your examination?
No.
No. Okay, fine. Okay. So, so how would you like to investigate this child?
First, I will like to go with X-ray of the right leg, including both ankle joints and the knee joint.
Okay.
Then I will order some basic blood investigation, full blood count, blood picture, and then inflammatory markers such as CRP, ESR.
Mm-hmm.
Then, if it's possible, I will like to look into do the ultrasound scan of both ultrasound scan of knee joint to see whether there is any uh, fluid inside the joint.
Okay.
Mm,
Okay, then how would you
then
like to manage this child?
I think first of all I would like to reduce his pain,
Okay.
give some painkillers, and discuss with the consultant to arrange further treatment, and if it's possible to discuss with the pediatric rheumatologist.
Mhm. Okay.
And if it's inflammatory markers and the full blood count show some signs of infection, then I will discuss to arrange some IV antibiotic with the rheumatologist or consultant.
Mhm. Okay, so like, what is your provisional differential diagnosis for this scenario?
Actually, if it's I think my first diagnosis actually it was septic arthritis, but seems to be involved both joints, ankle and knee joints. And then I would like to consider oligoarticular juvenile arthritis, rheumatoid arthritis, and then trauma.
Okay, time up. Okay. So, how did you perform?
No, not for me. I think I did it so badly.
No, it's good. Like you took it by surprise, so it's good. So, feedback from other people, the doctors, so how we could improve further.
Hmm.
In MSK, if you should have first asked the 3 questions, before starting the examination.
Yeah,
And
good.
then
So what questions you
and
will ask?
then the three questions are: is your child having any aches and pains in any of your muscles and joints? Secondly, is he able to climb stairs? Is the child having any problem in dressing and undressing? These are the three questions. And
Yeah.
after that, proceed with the general observation first, and then
Yeah.
the examination.
Yeah.
In general observation, you'll ask whether the child looks well or ill, whether the child is does have any walking aids or any calipers or anything around him. Then
This child
ask for the
glasses,
nutrition.
okay? So you're looking for devices. This child then shows the glasses.
Yeah, if visual aids and any other walking aids also. I
No
look for
walking
it
aids.
if it's no walking aids. Yeah, and then ask whether the child looks well grown for age, for the nutrition status, and then ask for any signs of dysmorphism, which doesn't seem to be here in this child. And after that, go for the examination. We usually start with a gait in case of lower limb, but this child is in. If the child is in a lot of pain, we'll have to do this carefully, asking the mother, can the child bear weight on the affected joint? And if so, is it possible to make the child walk for just a short distance? Does he have an antalgic gait, basically? And
Okay.
if the mother said that the child is not able to walk at all, then I think we should not proceed with the gait. And rest, when we examine the lower limb first, in the first is we proceed in a look, feel, and move a manner. Look for any scars,
Yeah.
any redness, any swelling, or any look for those, and feel for the feel for capitis.
Yeah.
This child has swelling, so it is important to feel for capitis, and also see for any signs of pain in the child. Look for signs of pain if
Tenderness.
when you're doing the manual.
Tenderness.
Yes, tenderness. Look for
Yeah.
tenderness, and then ask the child first to actively move the joint to the degree that he can. Just first observe how much the child can move. Look for the level of limitation of movement rather than you moving the joint, because by doing so you might
Yes.
injure the child. So rather let the child move to a degree that the child can, and after that you note how much is the limitation in each of the movements, in hip flexion, knee flexion, extension, then ankle, plantar flexion, dorsiflexion. Ask the child to do them actively and see what
Okay.
is the limitation
So
of movement.
so you mean to tell that we need to do active range of movements first. Okay.
Yes.
Then compare to the opposite limb. Then you can go for a passive range of movements. So why do you need to go for active range of movements and passive range of movements? Anything important with that?
Yes, in
So when
MSK examination, it is always important to look for active movement rather than passive. We do in
passive
neurological
movements.
examination, we go for passive. We do passive
Okay.
movements, but here we need to see whether the child is able to make active movements. How much his movement is limited, basically,
Okay.
and uh, based on that, we give our observation, if and we move actually one joint up and one joint down. In this case, we cannot do much with the knee because it seems swollen and the baby is not able to move. But we can see the hip as well as the ankle. Do the maneuvers and try and see how much there is limitation, and compare it with the normal side.
Yeah. Okay. So the important thing is we have to compare with the opposite limb. Okay. So that is very important. So we have to compare each joint across it. So good. Yeah. So any further feedback? Anybody else? So one thing is like the screening questions should not be missed. Okay, in MSK system, screening questions are very important. Okay, so that thing I want to highlight. And second thing is never miss the initial thing, general examination, the 4Ds. Okay, so the devices, dysmorphism, distress, and dimensions should be there in all stations. So you just remember this 4Ds. Irrespective of the station, you have to look for all these things because this child wearing glasses, does it carry any significance? Anybody could think of something with respect to glasses in a child with joint pain?
The child could be having uveitis, sir. So it could be a
Exactly.
case of JIA.
So the child could be a case of uveitis. Maybe she is wearing these glasses for that purpose, for the refraction function. Okay. So always look for those these 4Ds in whatever case maybe it is. So this will help you in like narrowing your diagnosis sometimes. And after looking for these things, the next thing is we have to better expose the child. Okay, the tipping point in MSK is better the gait and exposing the back and the legs in whatever possible way. Because here the clear instruction is do an MSK examination of the lower limb. Okay, so when you see a swelling here, it is better to go directly to the swelling. Okay. So when there is an obvious pathology you notice, okay, clinical sign you notice, it's better we go for the joint directly. Okay. So after that, you can examine the other joints. So first thing is, so here we have an obvious swelling in the knee. So go for the examination of the knee. Okay. So examination, as you are rightly pointed out, it should be the look, feel, and move approach. Okay. So you should look at the joint, compare the opposite joint, always compare. Okay. Always look the joint above and below. Okay. So comment upon the muscle, whether any atrophy or obvious atrophy is there or something is there. Okay, any redness in the skin is there. Okay. Then the feel approach, you have to look for the swelling, you have to look for the tenderness and tenderness at the joint line. Then you have to look for any crepitus if it's there. So those things can be done. And then you can go for the movement. You can go for the active movements first. Okay. Now, I have a question here. Like, are you going to do PCALs here for the lower limb? Is it required when you have a swelling?
No, when we have swelling, first it is that particular joint and one joint above and below.
Yes. So when you have swelling, always go to the examination of swelling first. Okay. So that will be the best thing to do. But if you have time, at least make an effort to do the PCALs of the lower limb. So why do we need to do PCALs of the lower limb here? Because there may be other joint which can be involved. Okay. So only if you do PCALs or if you do full examination of all the joints, you will be able to get findings in those joints also. Okay. So sometimes the other joint may not be as swollen as obviously as the joint, but there can be involvement of a small joint. So if you are to do the PCALs of the lower limb, you can pick up the other joint also. Okay. So at least at the end of examination, try to tell that you are about to do a PCALs of the lower limb. Okay. See, sometimes when we don't have time in other station, the best thing is you can always, after the time is over, you can tell in order to complete my examination, I would like to do so and so, so and so. Okay. So in MSK system, the thing is always in order to complete, we will do the vitals. Okay. If it is a bigger child, we will also do the Tanner staging and growth and other things. Okay. And in MSK, particularly, you will do an examination of the skin, hair, and nails. Can somebody tell for what purpose?
Psoriasis,
Exactly. Good.
psoriatic
So,
arthritis.
one is psoriasis and psoriatic arthritis can be a differential if you have a child with joint pain. Other one is any constitutional disorders may have a rash, may have things. So those things you have to see the examination of skin, hair, and nails. You can tell that I will do in order to complete my examination. Okay. The other thing is examination of eyes. You will definitely involve the ophthalmology here. Okay. So that is very important here. And you have to do a PCALs of the upper limb also. Okay. So why PCALs of upper limb in order to complete? Because that may change your diagnosis. If there are more joints involved there, say for example in elbow or shoulder, then this may not be oligoarticular. This can be another.
Polyotic.
So you need not examine the upper limb, but in order to complete your examination, you can add up that I would like to do a PCALs of the upper limb also. Okay. So the differentials you can go with the at least give a 3 differentials. Always have one differential which is very straightforward. For example, this case you have two joints. Joint is not red not an angry looking joint. So we can definitely JA as initial diagnosis. Okay. So you can have an oligodeclared JA as an initial diagnosis. Okay. Maybe septic arthritis is down the line. What
Reactive
else?
arthritis.
Okay, reactive arthritis lower limb. So still it's visible. Now, do not say that rheumatoid arthritis or reactive arthritis in children, because they have a different terminologies there in children. The nomenclature is different. So we don't say rheumatoid arthritis in children. Okay. So other thing is in case you think this child can be other thing, other possibly differential diagnosis if the child is having, say, for example, an ognomegaly. If the examiner gives it, so this child
Any
has an
infections or leukemia?
yeah. So the point of MRCPCH is like how safe doctor for you. That's the main crux of the examination. So always have those hard hitting points in your differentials at least down the lane. Okay. So malignancy should be in your thought if this child has an ognomegaly, or the examiner gives a clue that this child has an ognomegaly or is on some medications, some infusion, so and so. Okay. Sometimes examiners will give a clue for that when they introduce a child to you. And particularly if you are in a developing country, maybe if you are in India, maybe taking exams in Asian countries, then still the child age is around 5 years and plus, you can go for rheumatic fever as an still a possibility, having involvement of knee and lower limb joints. Okay. So those can be differential. And the management plan, the doctor has elaborated. She told about blood counts, smear, and acute phase response like ESR, CRP, X-ray. Now, any further investigations like very useful in this side?
Peripheral smear?
Yeah, peripheral smear, the doctor has told, yes, peripheral smear. So, JAA, oligoarticular uveitis, you like to do anything specific?
Yes, ANA profile and
Yeah, okay.
com
Okay. So this is one arthritis like where we do not think of RF and other things. We think of ANA. Okay. So so one of you maybe like put up the risk factors for an JA uveitis group. Okay. So it will be good for all of us to learn. So where we do what are the risk factors for an JA child uveitis. So in that ANA will come. Okay. So investigations ANA should be there in this side. And management part always involve the team. Okay, so you just tell that I will review the whole records of the child. I involve the team, involving my consultant, pediatric rheumatology, and ophthalmology, and maybe a physiotherapy, occupational therapies, and so on. Okay, so always involve the team first. And you definitely told about the pain relief part. That is very good. So you will start the child on NSAIDs. Then you will definitely take an ophthalmology referral, do a slit lamp examination, then go further with the management of uveitis, then giving rest to the joints, then start restorative physiotherapy, then counsel the family, need for follow-up. So that way, that should be a complete. Okay. So it is only 3 minutes with the examiner. Okay, so you divide your part. Do not go very specific into any area. You can go like involving the team. Okay, so when you bring in the team, that will definitely take your time of 3 minutes. At least you will cover everything. Okay. So any doubts here? Anyway, thank you for volunteering. Okay, at the last minute.
But I feel so bad about that.
No, you did. You almost managed to pick up the knee joint. You pick up the ankle joint. The thing is, like, you need to be structured. Okay, so maybe next time you will think about the questions, the screening questionnaires, and think about the 4Ds, and think about the look, feel, and move approach.
Thank you, Dr. Sabir.
Any further doubts? Or shall we close for today? Okay. Maybe in the coming classes we can discuss more like this, like what will you think if there is a joint pain and rash, arthritis, and multiple deformities is there. So those things we will discuss. Okay, further. So maybe one of you can post the risk factors for VATs in JEA. What are you going to think? Investigations, those things. And the nomenclature is changed. Okay, the JEA nomenclature, oligoticular, everything is getting changed. Maybe if somebody is interested, they can post in the group what is the new nomenclature they are using for general arthritis. Okay. So thank you all for listening, for being here, and the volunteers for presenting. Shall we close?